now, this is one of the responses I'm looking forward to, because I think we do all have a role as the public and the community, and that while we might not understand that some people say that child abuse and neglect is a public health issue, we really need to look at it that way as well. And helping us do that is our Commissioner of Public Health, Brenda Fitzgerald. We've heard examples of many tragedies that might have been prevented. So can you tell us how we and public health in particular can help to prevent these deaths?
Absolutely. Thank you so much for asking me to be here. It's a real pleasure to be in a situation where we're looking at solutions for a problem that we want to correct here in the state. There's a couple of data points that I want to give you so you can think about the children that we've lost this past year. Of the deaths that occurred, here's one important number. Half of them, 48%, were 1 year of age or younger. That's a really important number. And one of the things public health is being involved in, we are in a public-private partnership to look at infant mortality. And that's the loss of our children throughout the state that we lose before up to 1 year of life. We're in a public-private partnership that is involved with the Academy of Pediatricians, the OBGYN Society, the Georgia Hospital Association, DeCal, and Public Health, and obviously we're looking at a lot of those reasons. I can tell you overall, the top reasons that children in that age group die is because 1, prematurity, and 2, congenital defects. Now, to look specifically at all the child deaths in this report, 42% of them had some medical issue. So when you're talking about the Childkind concerns, 42% had some medical issue. And of those, about half of them had a congenital problem. So when we're looking at these child deaths, we've got to realize that there is a lot we can do, and quite frankly, there's some things we may not be able to correct because they have congenital problems. But we can work with our infant mortality, especially SIDS. Public Health was very involved in the SIDS effort, the ABC, always alone on your back and in a crib, not cold sleeping. So we were involved with the First Lady's Children's Cabinet in making sure that every single agency had access to posters to raise the awareness. So you go get your driver's license and there's a poster talking about SIDS. You go to a public health department and there's a poster talking about SIDS and the ABCs and what to do. So we're very encouraged by that, and we think we'll make progress there. The other two things, though, that I think public health is involved in and we want to be part of the solution is, one, public health has the data. We have the birth certificates, we have the hospital reports, we have the death certificates. And we are involved, we started this last year, involved with a private researching group looking at all our data to see if we can come up with a predictive model. Is there something that we can look at? Is there something that will indicate something that might lead to child abuse? Effort is underway for about a year. I don't have anything to report, but I'm hopeful that we will find something so that we can look at those children, and as soon as we get their birth certificates, we can say, aha, that child may be at increased risk. We're now doing that already with some medical conditions, and I'm hopeful that we can expand that to the social aspects so that we prevent child abuse in the state. The third thing where I'm hoping that public health can be helpful is we now have a telehealth network that is in every single county. That means every single health department in all 159 counties have the capability now to do distance communication. And that whole business about if you live in South Georgia and you have to get to Atlanta to get your specialty care, we are hoping that we can work with you, Director Cagle, so that we can facilitate some of those reactions and some of those interactions. Because clearly, if we can predict who is most at risk, and we can identify them early, and then we can increase the serviceability to them, I'm hoping that we can have some impact. Again, public health stands at the ready to make sure that we solve this problem together.